Right, now let's just get straight
Yes,
to it.
yes. So, Madam Mary, as we call her, is here with us to help demonstrate, and we're also going to co-opt you. But really the first thing that we said, the 3 steps are look, move, and feel. And so with looking, we're basically trying to look at both breasts, trying to see is there any symmetry, is there any new increase in size. We're looking at how the nipple areola area looks, are there any changes, pulling or rashes around there. We're also looking at the breast tissue and trying to see is it similar on both sides. As I mentioned earlier, the one side, your 2 sides are never exactly the same, but what you're really looking for is there's sudden increase in size. So that's all part of the looking phase. And sometimes you may just notice maybe a bit of a discharge, usually if it's bloody or different colored, and those would be things to look out for. So that's part of the look. The second bit is the move. And so what we say is you want to put both hands above your head. And so if we can just sort of do that, when you do that, what you notice is that both breasts should move up together. And so if for whichever reason either you notice that one side is moving up and the other side is staying down, that's just something to watch out for. And then still with your hands behind your head, and just keeping them there, you do want to turn to the side and just have a look. If you're looking in the mirror, you want to be able to look and see is there anything happening on the sides. Just because either we're so used to looking at the front, we actually forget that there could be stuff going on the sides. And then once you do that, you put both hands on your hips and you press in and forwards. And what that does is you can even start to feel these muscles tightening, right? And so sometimes if you have a very small, very subtle lump, sometimes doing that can tend to make it a little more prominent. And then now the final component is feeling. And we wanted to just try and demonstrate the process. As I was saying earlier, and we're going to use you as the guinea pig. Mary here has generously agreed for us to use her. But what we're saying, Ida, is technique matters. If you feel with your tips like that, 9 times out of 10, you're always going to feel a lump. So it's important to have the correct technique. And the correct technique involves using the 3 pads, and you use the pad with your hand. And what you're doing is you're pressing down gently the breast tissue against the chest wall, and you're going round in a circular manner and trying to feel if there's anything sort of hitting your hand. And so we'll just get you to gently press down and go round in a circular manner and try and feel whether you can feel anything. Do you feel anything when you do that?
Yeah.
Let's see. We need to confirm. Yes. So you feel how that feels, how it feels like a marble against your hand. That's how you tell. The rationale behind it, Ida, is that breast tissue is compressible. So when you press in, it goes in. But if there is a lump, then it stays up, and that's why you're actually able to feel something, right? Now, if just for argument's sake, notice that if we feel this edge, it feels like there's things in there, right? But when you press down, you realize that it's actually different from how that feels. And that's why it's important to have the correct technique. Now, sometimes ladies come and they do that. They're pressing and feeling things. And as we say, 9 times out of 10, you're always going to feel something. And so it's important to know the correct technique so that you're not stressing yourself at home. However, if something feels off, just come through to the hospital. The other last component of this is just feeling under the armpit. You know the way sometimes when you have a sore throat, you notice the swellings in your neck. So what happens is that if there's a problem with the arm or with the breast, sometimes you may notice that the glands under the arm are swollen. And so it's important to check once you've done with the breast, done with the nipple areola area, which is a darker area in the middle, just feeling under the armpit to make sure, and even along the collarbone, to make sure that there isn't any swelling and stuff. Because sometimes you may not even feel a lump, but the first sign that you might get is a swelling under the armpit. It doesn't necessarily mean that there is a breast cancer, but for instance, if you're having an infection in the arm, or maybe you've shaved, you may notice that the glands under the arm are swollen, but it's really important to know what that feels like and not ignore it and get it checked out.
So by under the armpits, you mean like right here or?
No, just under the armpit, just using the flat of your hand as well and just feeling, just gently pressing along there and trying to feel whether there's anything swollen as well.
All right.
Yeah.
Now you've mentioned over how let me say some of us will probably press.
Yeah.
How do you now examine, let me say, the nipple? Do you press for probably you to find out if there is a discharge, or how exactly?
No,
do you do that?
we generally don't encourage sort of squeezing, because sometimes that's what ladies do. They squeeze and squeeze until they get a secretion. And so we try and distinguish between what we call a secretion versus a discharge. A secretion is what you have to remove, like the ladies who, you know, every shower you're there tentatively pressing, as opposed to a discharge which comes out on its own. So sometimes you may notice that ladies who have a discharge will tell you they didn't even do anything. Maybe they just had a shower, they're drying themselves, and there's a discharge coming out. You generally don't have to go checking unless if there's a discharge, it will probably declare itself. But the important thing to do is really look. Make sure there aren't any nipple changes, make sure there really isn't anything coming out. But sometimes what happens is the more you check, ironically, the more you set up messages to your brain that supplies are required. And so that can even sometimes set up a whole process that actually ironically helps you get more of a discharge the more you keep checking. So we say, just look at the nipple, inspect it normally. If there's a discharge, it will really tend to declare itself. Yeah.
Okay, great. I think I don't know, maybe you can just do it one last time, the touch technique.
Yes,
because I just learned that you don't just, you touch and...
yes,
like
so what you're doing
is
is using the pads of your hand, just as opposed to the tips, we use the pads. And what you're doing is you're just gently pressing down the breast tissue against the chest wall. You're going round in a circular manner, making sure you cover the entire breast. And depending on, you know, how big your breast is, you may have to make several circular trips, but then ending with the nipple areola area. But what you're doing at each step of the way is that you're gently pressing in the breast tissue against the chest wall and trying to see if there's anything that's sort of bouncing back and hitting your hand.
All right, that's great. And if you have any question right there at home, feel free to send in a question or just a comment as far as our topic of discussion this morning is concerned, that is a breast cancer screening, and what we've focused on, that is with the help of Dr. Mutebi, is the self-breast examination. And if you're just joining us, you can definitely find it on this recording just to help learn of how exactly to do a self-breast examination. Remember, October is a breast cancer awareness month, and that's exactly what we have been doing on this particular segment on the CAC in the Morning Show. Now to you, Dr. Mutebi, maybe just your parting shot or just a summary of everything that we've discussed this morning.
Thanks, Ida. I think really the message is let's take charge of our health. We do know that there's always hope, there's always treatment, irrespective of the stage of cancer, especially breast cancers. We know that treated, diagnosed early, treated appropriately, there's an overall outcome. The outcome is generally good. However, the goals of treatment change depending on the stage, where with early cancers, which is what we're really hoping for, we're looking to not only treat but cure. With more advanced cancers, we might be able to treat to control but not completely cure. So it's really important for us to take charge of our health. And I think my key message is that don't wait for October. You know, we are always having this excitement. Yes.
When everyone now makes noise.
Exactly. But we know that breast awareness and breast health is a continuous process. So, you know, find out what's normal for you, learn how to examine, go for regular screening. Don't wait to develop symptoms. Really just take charge of your own health.
Okay. Now I have two questions. My director is a man and he's really pressing me to ask these.
Yes.
So for the self-breast examination, is it the same for men as well? Then we have this notion of what exactly is happening around October, that is Saka breast. And a number of women, probably, it is said that a number of women who end up probably just feeling the lump in their breast is as a result of probably their partner identifying that particular lump. What's your comment on that, as well as the self-breast examination for men?
Sure. And I think in terms of the self-breast exam, because what happens is that whether you're male or female, we all have breast tissue, and it's just the amount of glandular tissue that is different for men and women. So men end up having less breast tissue, but however, the principle is still the same. You're still able to go around the entire breast, feel if there's any lumps or or any changes or anything or thickening like that. And then the second comment is really around sucker breast, and we're saying we're not necessarily advocating a wholesale return to innocence and having men on the streets looking for breasts to suck, but I think it's really speaking to the question around awareness is a combined effort. Right, and so if you have a partner, then you would encourage your partner. It's interestingly enough, what we've realized, especially with screening, and not just for cancers, it's that patients who are married or in a relationship are more likely to go for screening for the simple reason that, you know, your partner is able to tell you, hey, when was the last time, and you'll be able to do, you know, vice versa for, you know, whatever, whether it's hypertension, whether it's whatever. So it's really that combined collaborative approach to, if you have a daughter, you have a mother, you have a sister, you have a partner, really the onus is on us to motivate. So it's not just a women's issue, it's a universal issue. We all have breasts. We may not necessarily have as much breast tissue, but we all have the responsibility. We always say we are our brother's keeper, our sister's keeper. And so the onus is on us to really galvanize our communities. If there's somebody who fits that age, there's really no reason, irrespective of whether or not they have, you know, a partner, to tell them, listen, I think maybe you should perhaps go for screening, and really trying to break down the stigma that is around breast cancer. Because we know that, you know, people say, sitaki kwenda kujitafutia. Where am I going to look for problems? And we're like, ironically, you do want to go and look for problems, because if you get them at that point, then the treatment is really minimal. Whereas if you're having a more extensive tumor, then now you have all sorts of therapies, whether it's surgery, whether it's chemotherapy, whether it's radiotherapy. And so really looking at how do we as a community galvanize ourselves and galvanize everyone in our immediate locus. So we would say, don't necessarily suck a breast, but really find somebody in your community who you can motivate to actually go for screening. And I think that will have a really profound impact.
Oh, thank you so much for ending it on that note. Now, we were looking at our breast cancer awareness, or breast cancer screening, October being a breast cancer awareness month, and that was Dr. Miriam Mutebi, a breast surgical oncologist at the Aga Khan University Hospital. Well, Dr. thank you so much for sharing.